Good evening, everyone, and welcome to the online platform of Education Committee Physiological Society of India. We have gathered here today for the November session of the online lecture series. The series of this lecture was initiated on 13th of July 2023. Since then, we have come a long way. Today's session is based on the topic Mechanisms of Autonomic Control in the Cardiovascular System. It is delivered by Dr. Animesh Dey, Assistant Professor, Department of Allied Health Sciences at Brainware University, Kolkata. Dr. Dey is at Brainware University, Kolkata for the past 14 years, extensive experience in teaching, research, and program coordination. He has completed his graduate degree from the University of Calcutta, Physiology, and obtained his PhD from Stanford University, specializing in molecular pharmacology. His research focuses on environmental ecology, neuroprotection, and effects of oxidative stress, with multiple applications
Dr. Animesh, I think Dr. Dakshani is having some technical issues. So Dr. Animesh will be presenting on the neural mechanisms of autonomic control in cardiovascular physiology. So Dr. Animesh, can you please start your presentation?
Okay, thank you. Thank you for my brief introduction. So let's start the lecture. So I'm presenting the screen. I think the screen is visible. Is this visible?
I'll just get your slides on stage.
Is the screen is visible?
Yes, sir, your slides are visible. I'll just bring it front and center and you can start presenting.
Is the screen visible? Hello?
Yes, sir, your slides are visible, sir. PSI Online Lecture Series, Neural Mechanisms of Autonomic Control.
Is the screen visible?
Yes, sir. Your screen is visible, sir.
Okay. Thank you. So let's start the session. So my topic is the neural mechanisms of autonomic control in the cardiovascular system. So before going to the main topic, first of all, I want to briefly inform about the main regions or the functions served by the cardiovascular control. So where it requires for the regulation of cardiovascular system in our body. So initially, it is responsible for to the increase of the blood supply to the active tissues, where the most active tissue is the skeletal muscle because it requires continuous source of blood circulation during the exercise process. And also the circulatory adjustment during different type of routine cardiovascular stress related changes in posture or during the excitement, fear, anxiety, meal, sleep, etc. And in the for the vital organs like brain, kidney, heart, there is also requirement of the maintenance of adequate blood circulation. And last of all, another part which is very important for us for the regulatory body temperature regulation during the heat loss, our cardiovascular adjustment also required. So these are the areas where cardiovascular control are required. So at two regions, the circulatory adjustments will be executed generally in our physiological system. We have to focus. One is the overall control of the blood volume, and another is overall regulation of the arterial blood pressure. Next part, before going to the neural regulation, these terms have to be remembered for all of us, because as we are discussing the regulation, there might be the changes of different uh, conditions of the cardiac responses. Number one, that is chronotropic action. This is the changes of heart rate. It might be increase or decrease according to our requirement. Next, inotropic action. This is actually the effect on force of contraction of the cardiac response. Third is dromotropic action, and this is actually the conducting impulse of the heart. And last of all, that is vasomotoric action, which is the effect on the excitability of the cardiac muscle. So at that 4 points, mainly the cardiac performance must be regulated. Okay, so another part where the cardiovascular, apart from the cardiac whole requirement, changes of diameter of the blood vessels, that is during the vasoconstriction and the vasodilation, we require some amount of regulation. That is the peripheral blood circulation, where cardiovascular regulation are important for us. So let's come to the main topic of discussion, that is the neural control mechanism. So in 3 areas, 3 different components, I will discuss the overall topic, because in the 1 hour duration, it is not possible to discuss all the things, all the regulation process, because this is a vast one area. So I will discuss at the 3-point level. Number 1, that is medullary cardiovascular control center, which is actually the autonomic control center. Next, autonomic nervous system, which supply the heart and the blood vessels. And third is afferent impulses, which can modulate the medullary centers. So based on the first point, the second and third point will be discussed later on. So for first point, the medullary cardiovascular control center is very important for our discussion. I will focus most of the part for this section. So what do you mean by medullary cardiovascular control center? It is also termed as vasomotor center. Actually, medullary sympathetic center is located particularly in the 2 regions. In the next slide, I will discuss in details. But in general, if I discuss in general discussion, the main point of medullary control center is situated at this region, which is called as vasomotor center. It is located at the medulla oblongata of brainstem, which is the primary sympathetic control system for our cardiovascular regulation. So this medullary sympathetic center is actually divided into 2 parts. One is rostral ventrolateral medulla, and another is caudal ventrolateral medulla. In the next slide, I will discuss about the location, where you can understand the actual location of these 2 centers. But for discussion, if we move to the next slide, these are the 2 areas of the medullary part where the pressure and the deep pressure areas are located. So we have to know the functions of these 2 areas, pressure area and deep pressure area. So this is the pressure area and this is the deep pressure area. So what do you mean by pressure area? So locationally, this is rostral part of the ventrolateral medulla. It consists of glutaminergic neurons, which actually excite the thoracolumbar spinal sympathetic neurons. So these neurons are specifically required for the sympathetic control, which actually continue or maintain our sympathetic tone, vasoconstrictor tone. The inherent capacity of this pressure area is about 1 impulse per second. That means that is 1 impulse is generated in rhythmic way, continuous manner. So what does pressure area or RVLM or rostral ventrolateral medulla does? The main function are the stimulatory effects. During the sympathetic stimulation, arteriolar constriction or venoconstriction, heart rate, increase of the heart rate. We already observed the increase of the heart rate situation, that is the chronotropic effect in general. So all of these are created by the pressure area. So the pressure area, actually we observe that it is located in this rostral part, which is responsible for primary constriction of the blood vessels and increase heart rate and increase force of contraction process. This force of contraction process is also important for the cardiac regulatory system. So next part is the deep pressure area, which is located at the caudal region, that is the caudal part of the ventrolateral medullary portion, which actually decreases the sympathetic activity. It is not actually the parasympathetic regulatory system, but it generally praise or regulate the pressure area. It decreases the sympathetic activity and inhibits the pressure area impulses. The main stimulation or stimulatory effect it is observed like that pressure area, it is opposite, like arteriolar dilation, venodilation, decreased heart rate, decreased force of contraction. So these are the prominent factors or prominent regulatory roles which are playing by the medullary sympathetic center. So medullary sympathetic center playing the important role related to sympathetic stimulation and also the inhibitory response or decreasing response against the sympathetic stimulation. So there are two parts. One is pressure area and the deep pressure area. So I have already mentioned in the diagram that this is the pressure area, and which is regulating or increasing our cardiovascular responses sympathetically, sympathetic stimulation, and another is the deep pressure area, which decreasing the sympathetic activity. So these are the two parts in the medullary region, or specifically medulla oblongata region, which are medullary center. So as we are discussing the sympathetic nervous system, we have to also mention the medullary parasympathetic center. It is located at nucleus ambiguous. The nucleus ambiguous is the part where this inhibitory, that means the parasympathetic activity is going on. For general discussion, I think it is known to all of us that autonomic nervous system has two parts, one sympathetic system, another is parasympathetic nervous system. Sympathetic nervous system is, along another nomenclature is that fight and flight response, whereas parasympathetic nervous system is responsible for recovery from the emergency situation. So that for that part, for emergency recovery portion, our neuronal activity must be maintained in that manner, in that regulatory part. So the neural activity during the medullary parasympathetic center is not tonically active. These are not tonically active, do not require to maintain the continuous activity. But the more specifically, the afferent input which comes from the nucleus tractus solitarius, which is the part of the upper region, nucleus ambiguous of the nucleus ambiguous, which is under control of nucleus tractus solitarius, and the efferent input, actually, which is the effective responses, like in case of parasympathetic nervous system, we have to inhibit the signal of the sympathetic responses. So these inhibitory signals going via vagal nerve to the heart. So what are the overall functions? So overall functions to decrease the heart rate and to reduce the force of cardiac contraction. So ultimately, if we parallelly discuss the function of the deep pressure area and the function of the parasympathetic nervous system, almost similar, but it acts in different way, because in deep pressure area generally coordinating the sympathetic nervous system but inhibitory function, but here the parasympathetic function is opposite, which is regulated by different pathway. Actually, it responsible for recovery from the emergency condition. For that purpose, we require the parasympathetic input, which is situated at the nucleus ambiguous. So next section. So depending on the medullary cardiovascular control center, the parasympathetic and sympathetic nervous systems are working together. Where, how they are performing. So for that part, we have to understand that autonomic nervous system which supply the heart and the blood vessels. So what are the distribution pattern and how they are distributed? We have to understand this. So for the autonomic nerve supply, uh, as you all know that autonomic nervous system is a two-part. One is sympathetic and the parasympathetic. First, we have to understand the sympathetic regulation. So sympathetic regulation, the neurons are located at the intermediolateral horn cells of spinal cord. It starts from the T1, that is thoracic segment, and it lasts up to the L2 or lumbar region 2 segment. So the regulatory points depends on the parallel sympathetic chains which are located preganglionic ganglionic chains which are located parallel to the spinal cord. Here you can observe the nature of the nerves which are originated from the T1 to L2 segment. These fibers, when transmitted the impulses to the ganglionic fiber or ganglionic region, they are all small and myelinated in nature. Whereas it forms the synapse at the superior, middle, and inferior part of the cervical region. Also, some part connected with the upper thoracic ganglia portion. So these are the locations where the preganglionic fibers are connected. So actually these are the ganglionic processes which run parallel to the spinal cord, and they are connected with the small myelinated nerves starting from the thoracic segment. So from the thoracic segment, the sympathetic ganglion transfer or the passes the information or stimulation or impulse is processed towards the ganglion system. And by response, the postganglionic fiber, those who are responsible for generating the effective responses, they are all long unmyelinated parts, and they pass via cardiac sympathetic nerves to the different parts of the hearts. You can observe the termination point. They are in here with the help of a red color. These postganglionic nerve signaling neurotransmitter system have been designated. These are all secreting norepinephrine, and adrenergic fibers are there, and they ultimately, you can observe, they ultimately terminated in different parts of the heart: SA node, AV node, cardiac muscles, and the ventricle. So all the areas where the regulations are required, we have to remember that the regulations are basically required for the increase of the force of contraction, increase of the or decrease of the heart rate. So this type of regulatory parts or regulatory involvement should be there in the pacemaker cells and the muscle regions. So force of contraction and the rate of contraction all must be regulated very crucially. So right side, the first sympathetic neurons are connected to the SA node region, whereas the left side the sympathetic regions primarily connected to the AV node region. So SA node and AV node both are connected with help of postganglionic fibers. So these postganglionic fibers again originated from the ganglia portion. They might be responsible for the regulation of cardiac actions. So what are the effects? Already mentioned, that is the increased heart rate, which is the positive chronotropic effect. Next, increased impulse of the conduction, that is the positive dromotropic effect. Next part is the increased myocardial excitability, that is positive vasomotoric effect. And the force of myocardial contraction can be also increased, that is the positive inotropic effect. So all of these under the regulation of cardiac sympathetic nervous system or sympathetic nerve stimulation, which are located very close to the spinal cord portion. But apart from the cardiac region, so as we have already mentioned in the previous slide, our main target for the regulation, one part is the heart, another part is the blood vessels, circulation of blood volume or circulation or vasoconstriction, vasodilation. So at that region, also sympathetic nervous system play important role. What are the roles in the sympathetic nerve? Causes simple vasoconstriction. So if there is a vasoconstriction occur, it increases the systemic vascular resistance, and the peripheral resistance is also increased, and that will increase the overall blood pressure. Similarly, in case of venular circulation play the same role, vasoconstriction, which reduces the venous capacity and increasing venous return to the heart. So almost for the overall activity of the cardiac responses, for increase the activity of the cardiac responses, we must have to increase the blood circulation. So that blood circulation is also under control of sympathetic nervous system. So in this figure, we can observe the overall regulatory portion for the sympathetic innervation. Here, the sympathetic nerves, superior cervical ganglion, which is which regulates the SA node portion, middle cervical ganglion, and inferior cervical ganglion, from which part the posterior part of the heart, the regulatory postganglionic fibers are terminated and regulating the overall responses of the heart. And also similar pattern, blood circulation is regulated in the arterial and the venular part. So this is under the control of postganglionic fiber that is coming from the arteries and to the venular portion. So this part, this is the nucleus tractus solitarius, where the sympathetic, parasympathetic functions are going on, and these are the RBLM and CBLM, that is the part for the pressure and the depressure areas. So this is the sympathetic regulation, which actually we are experiencing in the daily routine. So during the autonomic regulation, the sympathetic regulation is directly influencing our all effective emergency responses during our daily activities, like during the stressful situation, during exercise, during any postural changes, wherever there is a requirement of the increased constriction process or overall load or blood circulation must have to increase, then the sympathetic regulation will be going on for all the body parts, not only the heart, also in the peripheral circulation, which affect the venous return or increasing the amount of the venous return, which will also responsible for cardiac circulation or regulatory functions of the cardiac circulation. So neurotransmitter, already mentioned before the discussion, that is the norepinephrine, which is the most effective neurotransmitter, and it is released by postganglionic sympathetic fibers, and which binds with the basically two receptors, with the help of two receptors. One is beta-1 adrenergic receptor and another is alpha-1 adrenergic receptors. So for the beta-1 adrenergic receptors, it predominantly present in the cardiac response or cardiac regions, and which stimulate the heart rate and force of contraction. Already mentioned the effect, but which is under control of the neurotransmitter norepinephrine, and which predominantly acting through the beta-1 adrenergic receptor. Whereas the alpha-1 adrenergic receptors, which are all are present generally in the smooth muscle, vascular smooth muscle, also causing the vasoconstriction. That is the requirement during the blood vessels, in the blood vessels. So in the heart, they are regulating by the beta-1 adrenergic receptor, and in the blood vessel, they are regulating via the alpha-1 adrenergic receptor, where it is required for the vasoconstriction. That is already we have observed in the previous slide what are the basic functions during the regulation of the sympathetic activity. In opposite portion, the parasympathetic supply. Here also, that preganglionic fibers, what are the basic anatomical difference between the sympathetic and the parasympathetic nervous system. This is applicable for all of our autonomic nervous system, not only the cardiac regulation. That preganglionic fibers are long and myelinated, but it arises directly from the medullary nucleus ambiguous, which is already discussed, medullary parasympathetic regulation part. And it is traveled through the help of the vagus nerve and cranial nerve, which is the cranial nerve 10, to the heart and synapse at the superficial and deep cardiac plexus. So these are very important to note. That is, where is the actual regulation of parasympathetic stimulation? It is regulating our cardiac plexus, which are very deep in the arterial wall surface, and the functional responses are the recovery from the stress or recovery from the any emergency situation. So postganglionic parasympathetic fibers are effectively regulating the arterial walls, arterial muscles. And you can observe the differences between the sympathetic and the parasympathetic nervous system. Here, the preganglionic fibers are very long because why? It comes from the brain. In the sympathetic nervous system, it starts from the spinal cord, T1 segment. So there is a difference. This is the difference. So cranial part is the most important regulatory region. It starts from the brain and it is very long myelinated nerve fibers, and ultimately it is terminated very close to the heart arterial wall surface. So preganglionic fibers are terminated here. Whereas in the last slide, if you observe, the preganglionic fibers are terminated here. So this is the basic difference of the regulatory portion for the sympathetic and the parasympathetic nervous system. So here the preganglionic fibers are terminated very close to the cardiac chambers, cardiac walls, and it is actually the deep cardiac plexus which is formed very close to the cardiac surface, cardiac wall, specifically arterial wall surface. But from that part, postganglionic fiber starts. So this is the postganglionic fibers, and they are very small and unmyelinated. Why? Because it is already inserted within the cardiac system. So it is not exposed to the blood circulation. It is already inserted, innervated within the cardiac muscle. So that's why this is small and unmyelinated. And at the same, like the sympathetic nervous system, it is also terminated at different portion of the arterial muscle, SA node, AV node, and other bundles, AV bundles or bundle of His, where the regulatory distributions are required. So the division for the detailed discussion, just I have mentioned here for vagus nerve, actually, which is the 10th cranial nerve, which are responsible for the parasympathetic innervation. It is divided into two parts. One is the right vagus, which is primarily innervated in the SA node, whereas the left vagus branch is primarily innervated in the AV node. So parallelly, there is a two controlling system of the parasympathetic nervous system. One is the right part, another is the left part. So this is all about the regulatory mechanisms, which is important for discussion for the SA node, AV node, and other vagal motor control system. So, the last point is important. That is no vagal motor fibers in the ventricles. So it is important to note down that is no regulatory responses is for the parasympathetic nervous system at the ventricular muscle wall, only at the superior part or the upper part of the cardiac system or cardiac structure. So what are the effects of the stimulation? Effect of the stimulation, if you observe, it is the negative responses. In the sympathetic nervous system, we observe the increase of the heart rate. Here, opposite, decrease of the heart rate. Decrease in the conduction through the conduction tissue, negative dromotrophic effect. And decrease excitability, that is negative bathmotropic effect. And the negative inotropic effect. So that's why I have mentioned in the at the first very beginning, the effective responses in case of cardiac tissues or cardiac regulation, the effective responses are generally at the four level. One is the heart rate regulation of the heart rate, another is the conduction, next is the excitability property, and the force of contraction. So at that effective regions, both positive and negative regulations are going on. Again, there is no effect on the ventricular contraction force. So based on that thing, I want to discuss one case study. This is important for general discussion, because already we have discussed the half portion. So at that, after the discussion, we can experience some uh, live case study. So for example, one background you had mentioned that a 45 years old male, Mr. A, visit to the clinic with complaints of frequent episodes of dizziness and rapid heartbeats. So especially during the physical exertion. So he has a history of hypertension and is currently on medication to manage his blood pressure. Recently, he has experienced increased stress at work. So that is indicating there are abnormal activity of the autonomic regulation. Why I have mentioned this case study here? It indicating the abnormal process. Actually, we have already discussed about the neurotransmitter receptors. So pharmacological aspect or medicinal approach for discussion of this situation, it is very common. It is very common situation. It can be experienced in the most of the cardiac patient, like that is the increased stress during the work. So what is the effective treatment or the medication or complication can be observed? So the clinical scenario after the routine investigation, because the person is experiencing increased stress. So after that, after clinical scenario which has been observed, that the blood pressure is noted about 150 to 95 millimeter of mercury, whereas the heart rate is 90 beats per minute, and his ECG is showing that the sign of tachycardia. So all are indicating there are increasing cardiac activity, regulation, autonomic regulatory activity, and most effectively that is the sympathetic activity is increasing. So what will be the diagnosis? The doctor will diagnose with sympathetic overactivity. So after the discussion of autonomic regulatory functions like sympathetic and parasympathetic nervous system, it is very clear. I think it will be clear to all of you that the sympathetic overactivity can contribute to the hypertensive episode, and that is observed at the clinical scenario. So at the clinical scenario, it has been noted that the blood pressure is high. So the person is experiencing hypertension. Heart rate is also high. That is experiencing of the tachycardia also. So all of these are due to the overactivity of the sympathetic nervous system. So what have I have discussed? Actually, this is can be clinically correlated with the help of case study. So ultimately, what will be the management? So what should be the management? The management should be the prescription must be given. The doctor prescribe the effective beta blocker. Why? In the earlier slide, we have already observed the receptors. I am just going to that slide for correlation of these responses. What we have observed that the beta-1 adrenergic receptors. So beta-1 adrenergic receptors are present at the heart at the different level. So norepinephrine will effectively acting on the heart at that region of beta-1 adrenergic receptor. So what doctor prescribe? So you can observe the doctor prescribe the blocker. Why? To reduce the activity of the sympathetic overload, because the sympathetic activity is overacting. The sympathetic activity is overacting, sympathetic response is overacting in the cardiac regions. So we have to inhibit. We have to inhibit the effects of norepinephrine and epinephrine on the heart. So for that purpose, beta blocker must be used. So there are different drugs. I am not going to the details discussion of the drug or pharmacological agents, but the main motto and the target for the management to reduce the heart rate and the blood pressure. So very specifically, the doctor will prescribe the beta blocker. So this is the application. So a physiological application we can correlate with the help of effective case study. So that is important. So the doctor also advises stress management techniques, which include regular exercise, relaxation exercise, and possibly psychological counseling. So these are the different part. But I have to just for relevant to our discussion, that is beta blocker is used, which is effectively reduce the epinephrine activity, because we can't control the release of epinephrine, norepinephrine. We can't control this, but we can control the effective response. How? The binding site. Norepinephrine, epinephrine will bind at the beta adrenergic receptor, and that should be locked for effective management. So after that, the patient will recover, and the lifestyle after the week of treatment and the lifestyle changes, the patient will maybe report the significant reduction in palpitation and dizziness. That means his blood pressure is under control, that indicating the blood pressure is under control, and the heart rate is also under control. And that will demonstrate the effectiveness of the targeting sympathetic regulation. This is the targeted drug activity for the management of the cardiovascular symptoms. So these are the effective responses. So based upon the section B, which I have discussed, the sympathetic and parasympathetic origin, um, overall the projections and the termination and the location where they are distributed and how they are working, what are the functions. So based upon the functions, we can observe the effective responses. For the blood supply, blood vessels, as I have discussed in the two domain, one is at the cardiac domain, another is peripheral blood circulation domain. So in the blood vessels, we also the two type of effective response that is already discussed. This is not new, because I have already discussed before that vasoconstriction and vasodilation. These two effective regulation is produced by the sympathetic fibers which supply the blood vessel, and they are originated from this same region, same activity. So this is the activity of the blood vessels region, and it is the sympathetic responses, postganglionic fiber, postganglionic sympathetic fiber, and it is under control of noradrenaline. It is responsible for noradrenaline secretion, which control the vasoconstriction process. Whereas the here vasoconstriction is the effective response, which is originated by the sympathetic stimulation, whereas the vasodilation is produced due to the decrease in the discharge of noradrenergic vasoconstrictor nerves. So for the noradrenergic vasoconstrictor nerves, if you can observe, the overall regulatory system are responsible, that is the noradrenaline. And the last part, that is the also there is a involvement of acetylcholine. So sympathetic cholinergic vasodilator nerves are responsible for activity in the other region, not in the blood vessel, in the skeletal muscles, cardiac muscle, lungs, liver, kidney, and uterus. So vasodilator nerves are responsible for invasive responses at the vasodilation system or functional regulation. So the last part, that is the superior neural control over the autonomic function, that is the afferent impulses to medullary center. I will not go into the details for this discussion, but overall, if we discuss the overall function of the autonomic nervous system, of the regulation of the autonomic nervous system, because autonomic nervous system function we have already discussed. Already we know it is known to us what are the branches and how the systems are going on. But at the upper level of the medullary system, upper part of the brain stem, that is, that is hypothalamus, and also forebrain, cerebral cortex. So these two parts are also regulating the autonomic control system. Autonomic control system is situated at the medulla oblongata. We have already observed, and their locations we already discussed in details, etc. But at the upper level, superior level, hypothalamus and also cerebral cortex regulating the effective function or effective regulation is there. So in case of hypothalamus, and first I have mentioned the medullary regulatory center, which is coming from the higher part. If we discuss that in brief, not I am going to the detailed discussion, because there are multiple afferent responses can contribute for regulation of the medullary centers. So medullary centers, the deep pressure area, parasympathetic, nucleus ambiguous. So all these areas, vasomotor centers for the sympathetic system, all these centers under control of hypothalamus. So what are the main function for the hypothalamic function, hypothalamic and the other functions? So for the hypothalamic function, if we observe hypothalamic regulatory system, the hypothalamic nerves are integrating system for many somatic and autonomic responses. Many somatic and autonomic responses are effectively integrate the regulation system. Here you can observe the hypothalamic regulation. Hypothalamic regulation is currently you can observing that it can induce the pressure area, and it can also reduce the activity at the deep pressure area. The positive sign indicating the stimulatory effect, and the negative sign also indicating the inhibitory effect. So both in the pressure area and the deep pressure area, both is under control of hypothalamus. And these two control system, if you want to discuss, that is most effectively regulation of the temperature and pain and emotion. So emotions, emotional changes during our we can experience during the stressful condition can effectively change the regulatory pattern. That is very obvious that during the emotional changes we can experience the changes of the cardiac activity, blood circulation, positive chronotrophic effect, dromotrophic effect, excitability. So all these effects can be changes due to the emotions. Similarly, in case of pain, so emotions and pain directly regulating the hypothalamus to stimulate the vasomotor center. So vasomotor center will be under the regulation of the hypothalamus, and most effectively they can regulate the temperature. We know that in general functions of the hypothalamus is responsible for the temperature regulation and also emotional stress regulation. So the effect of temperature changes in the hypothalamic center is relayed, it is conducted or relayed to the medulla, and which causes the blood vessels of the skin to constrict. That is heat conservation. That is actually the heat conservation. So during the autonomic nervous system stimulation, that is the sympathetic activity, we experience the activity of the heat conservation. Similarly, in case of emotional state, heart rate and the blood pressure, both can be changed. So that is also related to the from the hypothalamus, which can stimulate or inhibit the medullary responses. So in this case, I am not going to the details of the respiratory effect, because this is a collaborative effect. This is not a single cardiac responses separate independently working and respiratory changes working separately. But the collaborative effect is very detailed and the described pattern. But here the cardiovascular reflex mechanism, it depends on reflex of the baroreceptor and the chemoreceptor. Those baroreceptors and the chemoreceptors are present in different parts of our circulatory system. In the very close to the coronary arterial region and aorta regions, there are existence of baroreceptor and the chemoreceptor. But this is not our present discussion. This is not related to our present discussion, because it will take some another 1 hour for for this part, because our main target to emphasize on the autonomic regulation. So autonomic regulation is how control this part, maybe the another session for the detailed discussion. So What are the effects? The cardiovascular reflex mechanism can be created with the help of baroreceptor and also for the chemoreceptor. Those are different pathway, different reflex pathway. And central nervous system, the ischemic response, and another is due to oxygen deficiency or blood circulation, there may be the changes can be occur. And the next is the Cushing reflex. Cushing reflex is very close to the cranial pressure. So intracranial pressure can induce the excessive changes of the vasomotor center regulation due to the changes of the intracranial pressure of the cerebral cortex or the brain part. If any pathological condition or any other reason due to tumor or any other abnormal situation, that Cushing reflex can cause the direct effect on the vasomotor center. It can stimulate the stressful activity in our body, and also the afferent from the nociceptive stimuli, that is pain. Nociceptive stimuli means pain sensation, pain afferent impulse. So any type of pain sensation can induce our changes, that can induce our emotional or emotional changes for the newborn baby or the lower early child. In children's cases, they can cry. uh, so emotional impact, painful sensation, that may be collaborated with each other, and they can induce the vasomotor activity. So pressure area and the deep pressure area both can be stimulated, whereas the pressure area will actively participating the spinal cord and the lateral sympathetic activity, that will stimulate the heart, and heart rate and the stroke volume all may be increased. And in case of blood vessel, that will increase the vasoconstriction and the venoconstriction. So this is through the pressure area. Whereas the deep pressure area, if it is stimulated, that can decrease the activity of the pressure area, and the overall response of the pressure will be inhibited. So in case of chemoreceptor and baroreceptor, they can be responsible for the contribution of internal regulation of the autonomic center, autonomic responses. Above the hypothalamus, here we are discussing the hypothalamus. Above the hypothalamus, there are another regulatory part, that is the cerebral cortex. We all know that this is the superior most region for forebrain part of our brain system. So in case of cerebral cortex, the descending tract that coming from the cerebral cortex, and that tract may be regulate the vasomotor area. And from the cerebral cortex, particularly from the limbic cortex, the information or the message will relay in the hypothalamus. And the most effective influences you can observe here, it is mentioned that one is tachycardia. So the increase the rate of contraction, force of contraction of the heart, both will be observed. Hypertension, that will be observed during the emotional changes. Bradycardia, and the fainting during the sudden emotional shock. That is the regulation. At a time, you can experience not a bradycardia, tachycardia. So whenever it is required for cerebral cortex, mainly through the limbic cortex, because limbic cortex is the actual area for the regulation of the emotion and emotional changes. So more specifically, it can be mentioned that cerebral cortex can regulate the uh, emotional pathway or emotional changes for the hypothalamus. Through hypothalamus, it can regulate the vasomotor area. So bradycardia and fainting during the sudden emotional shock, it may be experienced for some of you, or some of them can experience the situation that sudden emotional shock can cause bradycardia, that is the decrease of cardiac activity, and the fainting, that is the sudden situation. So the fight and flight responses, which is actually the increasing cardiac output and the blood pressure, is very important for the anticipation response or anticipation mediated process. So apart from the cerebral cortical activity, also our brain can experience several regulatory pattern in case of reticular formation. I have not mentioned here for detailed discussion because almost the time is over. So reticular formation of the pons, mesencephalon, and diencephalon all can influence the vasomotor area. How and why? Because the pain generally it rises in the blood pressure if, via the efferent pathway or efferent impulses can occur. So if the pain sensation increases impulse in the reticular formation, it can directly regulate the vasomotor area. So prolonged sensation of pain can cause vasodilation and fainting. Why? So the question is arised due to this regulatory pattern. So pain directly cause the changes of the blood pressure. Pain reduce the changes of the blood pressure. So this is under the regulation of the pons and upper pons region. So in this pattern, the reticular formation of the brain also working together. This part is totally related to the emotional changes, pain, nociceptive stimuli, and also related to this emotional condition. But similarly, during the respiratory changes or respiratory activities, there can be observation of the regulatory responses. Like respiratory center, which is actually present in the medullary region, medullary respiratory center, they can regulate our cardiac activity. They can affect the heart rate. They can affect the heart rate by reducing the or changing the vagal tone, and it can create the sinus arrhythmia also for the respiratory uh, changes, for the respiratory regulation. Where during the inspiration it can experience, during the inspiration the impulses arising from the respiratory center can inhibit the cardiac vagal tone. That is the cardiac vagal tone can be inhibited. Respiratory center, that is inhibitory responses during the respiration, cardiac vagal tone can be inhibited. So that can reduce the vagal tone and also the tachycardia, sinus tachycardia. And during the expiration, generally, during the expiratory responses, the activity of the inhibitory responses will be stopped. Inhibitory responses may be stopped during the expiration process, and that cardiac vagal center will cause the increase of vagal tone. So respiratory regulation, respiratory centers, which is different this part of the discussion, or that is the due to the oxygen and O2 supply, CO2 and CO2 supply, chemoreceptor activities are there, but they may be regulating our cardiac activity in different way. So this is all about the discussion part, and the cardiovascular regulation will be, I have discussed in the three domain. One is the medullary regulatory center, medullary autonomic center, because this is the main center which is regulating the basic autonomic function. Second is the distribution of the sympathetic and parasympathetic nervous system, how the at the terminal level autonomic nervous systems are working in the heart and the blood vessel. And third, that is very complex and the vast area. I am not discussing in the details, but I am just informing you about the points where the regulatory centers are located for the overall autonomic control from the superior part for the higher center. From the higher center, hypothalamus, above the part, cerebral cortex, and also some reticular formation from pons region, there may be the regulatory systems are working. But these are very much related to the emotional changes, pain sensation. So these are the overall responses we can experience during the regulation. That is the we have already seen. So this is all about my discussion, my topic. And if you have any question, you can uh, ask, or moderator can ask to me. Thank you. I have got one question that parasympathetic stimulation can decrease heart rate because of its effects on SNO. Do they affect cardiac contractility at higher stimulation? Yes, parasympathetic stimulation can decrease heart rate because it has effect. So, cardiac contractility at also it will change. Yes, definitely. Do they affect the cardiac contractility? Stimulation that will be changed. Any question? Any other?
Hello, Dr. Dey. It was a nice
Yes.
presentation, and we are thank you very much for your presentation. It was a very good presentation. It was nice, and you have covered all the areas related to the autonomic control of the cardiovascular system, heart particularly. I would like to as Dr. Mahesh has asked this question. To continue with that, I would like to ask you, if you can please elaborate the molecular mechanism of how the autonomic system or sympathetic or parasympathetic separately, how they are controlling the effects in case of their like positive inotropism or negative inotropism, positive bromotropism, chronotropism, those impacts, how that is being transferred. Like we have learned that that is through the adrenergic system and the cholinergic system. But apart from that, what could be the what is the mechanism, possible mechanism to do that?
Possible mechanisms, actually it depends on the uh, activity of the neural signaling and neurotransmitter. You asked to elaborately describe the molecular mechanisms.
Not just to let like our audience students to know that how the neural control is converted into a mechanical control, because the heart is a mechanical control. How the
Yes, yes.
mechanical control is the neural control is controlling the mechanical part. That's what, just to let them inform
Okay,
about
okay,
that.
okay,
That's what.
okay. Actually, that depends on the different baroreceptors. Those so high pressure baroreceptor, those which are present in different parts of the cardiac system and very close to the cardiac system, like aortic arch, carotid sinus, or wall of the ventricles. So these baroreceptors are mainly for regulating the localized responses. So or the cardiopulmonary pulmonary changes or the overall changes that we have already observed, the regulatory mechanisms specifically in the neurotransmitter level, they effectively regulated by different baroreceptors which are present throughout our regions. We have already mentioned, that is carotid sinus, aortic arch, left ventricle, and the other regions of the arterial portion. So that portion, that regions specifically regulating the mechanical changes. So that sensory changes. So for detailed discussion, I have to go for another presentation, but that in limited time, that will be very
Yeah,
difficult to
I agree. I agree. Just
describe.
to let the student understand, those who are listening, to make them understand about the uh, that ion channels with the modification of the ion channels and cell
Yes,
signaling,
cells.
so that the pre-potential or the pacemaker potential slope,
Hmm.
that is the major factor
Yes, yes.
in.
Pacemaker potential is the major factor, and also the cardiac action potential for other
Yes, the
ventricular
slope part,
muscle
the
also.
ion
Yes,
channel modification of the ion channel. I think students, they already know about the ion channels involved in
yes.
the pacemaker potential in the at the iso as well as at the myocardium. So those ion channels activity, functioning, or rate of ionic flux can be modified, and that can be useful for the effectiveness of these autonomic control on the cardiovascular system. Yes, you have done a great job, and from the
Actually, I am focusing on the
society.
neural control. So this part I
Yeah,
am
I
not
agree. I
mentioning
agree. Just to
that it
just
is.
to put touch
Uh,
upon nothing else. Just to
yes,
touch upon that.
yes, yes,
It
yes,
can
yes.
be like that could be a nice communication between the two things. That's why I just wanted to let you discuss about this. In addition to that, it's you have made a very good presentation about the overall control. So that's a great. It's a big thanks from our side and from the society side. And I think we have a vote of thanks ready for you. Yes,
Ye-
madam, please.
Yes, sir. Thank you, sir. A very good evening to everyone present here. It's my privilege to propose a vote of thanks and acknowledge the contribution of those who worked really hard to make this presentation possible today. I, Dr. Mousumi Dotto, on behalf of PSI Education Committee, extend my sincere thanks to the Almighty for making today's program a grand success. And I extend a hearty vote of thanks to our eminent speaker, Dr. Animesh Dey, Assistant Professor, Department of Allied Health Sciences, Brainware University, who spared his time from his busy schedule for this presentation. And today we had an opportunity to hear your thoughts and your knowledge on the neural mechanisms of autonomic control in the cardiovascular system. All of us know that cardiovascular system is one of the most important and vital and predominant regulatory system of physiology, human physiology. So today's lecture on this regulatory mechanism of the cardiovascular system will encourage the students in future endeavors. I think so. And your lecturer have shown a new perspectives and on this regard. I want to appreciate your effort for making this presentation so informative for all of us. Thank you. I must mention our deep sense of appreciation to Professor Prosunpriyo Naik, President of PSI Education Committee. Thank you, sir. I would like to express our sincere thanks to Dr. Kaushik Bharati, sir, advisor of PSI Education Committee, and also want to thank Dr. Shampa Sarkar Bishwas, convener of PSI Education Committee, for giving an excellent coverage to the program. I would like to give thanks to Dr. Dakshayani Mahapatro, coordinator of this present lecture session. Thank you all of the members present here. Lastly, I want to mention here that the next month's presentation will cover the topic myasthenia gravis, and the title of the presentation is Myasthenia Gravis Insights and Innovation. This session will be held on 28th December 2024 from 7 p.m. And this lecture will be delivered by Dr. Kamalesh Das, Assistant Professor, Department of Physiology, Uluberia College, Howrah. And this session will be coordinated by myself. Thank you. Thank you to all, and good night to everyone. Thank you, sir. Thank you.
Yeah, that's so
Thank
nice
you.
of you, Dr. Mosumi. And
Thank you, sir.
from myself, as I am present here, I wish to